Good morning. Well, morning for me, evening for you, maybe, whenever you're listening to this in preparation for our week 2 content. This is Introduction to Clinical Education. This is chapter 5 out of the Adler book. Okay. And hopefully it won't always, oh, look, that patient is fake. That's a mannequin. So see, your eye doesn't even track to that. It tracks to all the people, tending to what looks like an emergency, but then down in the lower right-hand corner, that is a CPR mannequin. So these are really, really good actors. Okay, our objectives for this chapter define terms that relate to the clinical education of medical imaging radiologic science professional. Why can't we just say radiologic technologist? Okay. Explain the purpose of the clinical education in medical imaging. Yes, clinical education is probably the most important part of your education as a radiologic technologist, learning how to actually perform the exams and do the job, and developing good habits for communication and attendance, and just good clinical skill sets. The steps the students may experience in the development of their clinical education skills, it's very natural. The way that we learned how to do performance tasks is we watch it. Maybe we read up. If it's rather complex, we read up on it or get a lesson about it first in a separate setting, okay, like a classroom setting. But then we try it out after we've seen it a couple times. So it's going to be observation first, right? And then attempt or assisting with the task. And then finally, the final step is performance, independent performance. Identify the types of supervision necessary to assure safety in the clinical setting. The credential does mean something. The credential means that that person is a qualified judge of what is and is not clinically appropriate, what is and is not diagnostic, so on and so forth. So the end product of our task in medical imaging is to make a medical image that can be used for diagnosis. You as a novice practitioner won't have the assessment skill yet. You'll be developing that as you go, but you won't have the assessment skill yet to determine whether or not a study is final and images are diagnostic and whether or not the study is complete. Okay, that's for a registered technologist. In addition to that, there's always the chance that the exam goes sideways. There's always the chance that your patient, especially your emergency room patient, has a medical emergency. They either fall, maybe respiratory distress, maybe cardiac arrest, those type of things. So we always want the trained and experienced staff nearby, just in case. So that's the other caveat. Yes, you can perform the exam and you're competent in it, but what if an emergency happens? You want the tech to be a resource to you if your patient starts to get dizzy or has an episode of something not related to the performance of the exam, more of, okay, now we're pivoting to this patient is fainting or having a heart attack or short of breath or those type of things. You need a tech within shouting distance for those types of situations. All right. Further objectives, aspects of assessment used to measure and document student performance. Well, there's basically 2 modes. There's competency. Are you competent in the performance of the various exams? Can you do those without egregious mistakes? Okay. And then the second is just an overall assessment and evaluation, if you will, of how well you're doing as a student, the whole package, not just are you competent in those exams, but are you playing the role of a student as a I wouldn't want to say an employee because you're not getting compensated for the work, but you're assisting with the workflow. You're participating in the function of the department and you're having a meaningful impact on the workflow. Okay? Adherence to clinical education policies regarding supervision and patient safety. Okay? That's one of the quickest ways to get kicked out of the program, is to be a hazard or a risk. If you don't understand what you're doing to such an extent that you're jeopardizing patient safety, then you can be removed from a clinical site. And if we find that that's warranted, we might just dismiss you from the program. It is healthcare. It's serious business. You know, it's not always like in the immediate the patient's life is at stake, but as an underlying theme, the patient's health and well-being is absolutely at stake in every single interaction, every single exam that we do. Okay. Communication strategies and steps taken by healthcare workers in the clinical setting. Now, I do have a separate lecture on communication skills. I'm not sure where that works into the syllabus, but we definitely won't be skipping it. So I'll be talking about communication strategies and tools of communication that we commonly utilize in the clinical setting. Communication is a little bit more formed and a little bit more specific in the clinical setting because we're conveying critical information. Again, that information directly affects the patient's health and well-being. Okay? Aspects of team steps and SBAR support teamwork and positive patient outcomes in the clinical setting. Okay? All right, so what are you going to experience in the clinical setting? Well, you're going to experience experience. What? Yeah. So we're going to talk to you about how X-ray works, how an exam is performed, how do you set up the positions, but that's not practical application of the knowledge. That's just a discussion in a classroom. Now that has certain advantages. We can dive deep and we can spend more time on some nuances and some things that you don't necessarily have time to slow down and contemplate in the clinical setting. But at the same time, the whole point of your education here is to make you proficient at performing the job. And so the best way to do that is to get you actually started performing the job and evaluate how you perform the job from the get-go. So you're not going to know a whole lot about what you're doing at the very beginning, but we're going to constantly drip in knowledge, and you're going to have a chance, it gives you a chance to apply that knowledge in the 3 domains of learning. You're going to be thinking about some things. You're going to be behaving in certain ways. That would be the cognitive and the affective. And then you're going to utilize your muscle memory in order to position and perform the positions, but also in order to manipulate the equipment, things of that nature. So it is technologies, or a technologist is somebody who studies tech, and so you're always going to be utilizing equipment, the very big toys, as I like to call them. Okay? So your taxonomy of learning, this is the 3 ways, the 3 modes of learning, if you will. There's a cognitive domain. There are definitely certain tasks that are all mental exercises, either recalling definitions or utilizing critical thinking skills, cause and effect relationships, understanding parallel versus perpendicular and applying that in a clinical setting, understanding how the X-ray beam behaves and how it affects the position or projection that you're trying to obtain, and how is the body part positioned relative to both the central ray and the image receptor, and what is that going to do? How is the anatomy going to be revealed? How is it going to affect the appearance of the image? Those type of things. Those are all things that you have to be aware of inside your head. Affective domain deals with values, attitudes, emotions, and feelings. You will be governing the mood of the room. If you are frantic and nervous, well, don't expect your patient to remain calm. You set the tone. If you are laid back and relaxed and you don't get rattled, then that's going to set a mood such that your patient is going to be relaxed and not rattled and settled, and you ease their anxiety by not displaying anxiety yourself. Okay? The first pulse that you need to check in an emergency is your own. And then finally, the psychomotor domain, riding a bicycle, using a KitchenAid mixer, brewing a pot of coffee. All these involve operating an automobile and driving to class or driving to the clinical setting. Those are all psychomotor skills. Your hands and your feet are performing tasks automatically with you not even having to think about it, put it on the front burner. How did you get to work, right? If you've been driving for a while, it just kind of magically, you jump in the car, you twist the key or you push the button, um, and then you grab the shifter and you put it into drive. Now, do you think about that, or does it just kind of automatically happen? It just kind of automatically happens. We put things on autopilot and we let the psychomotor, and it's an amazing system. And it's used for all types of physical activity that are repetitive tasks. And that's why that's another reason we have you practice in the clinical setting, is because the positions don't change. A 3-view wrist is a 3-view wrist, no matter if it's your first time attempting it or if it's your 5,000th. Okay? And so once you get the muscle memory down of how do you position for a 3-view wrist, it becomes automatic to you. And so that's another reason for lots and lots of time in clinical education, is because we do want your positioning skills to be automatic. And so we've got a basic game plan recommended to us by ASRT and the JRC ERT, and it's to your knowledge poor and therefore practice poor, but you can't become practice proficient until you're knowledge proficient. So we have to dump knowledge on you in large quantities from the get-go. So most of your education is didactic education through the first year. Okay, and then we start sprinkling in laboratory, where we have like a simulation of a live. It's not really a live patient yet. It's one of your fellow classmates, but we are pretending like we're performing an X-ray, and we get to practice the various positions and talk about exam performance and the things that you have to do, the preparatory stage of exam performance, the actual performance stage, and then the follow-up and wrap-up. So there is a beginning, a middle, and an ending to every exam. And we're going to break those apart in laboratory and talk about those things. And each time we'll be diving into the various domains. The preparatory phase has a lot to do with cognitive domain, but also with affective domain. The performance phase is dominated by the psychomotor domain. And then the wrap-up phase is again cognitive and affective domain. Okay, and so we dump the knowledge in class. That's what didactic means. It's classroom instruction. Then we practice in laboratory, and then you go out. The best education is Okay, we've talked about it, we've simulated the scenario. Now I'm going to go and try to do this on a real live patient, okay? Which is because the stakes are higher, it's really effective learning. You'll be amazed at, it's very much like you're taking a superhuman sensory pill that for those first few weeks of clinical education. You'll be amazed at just how much you notice, how much you're paying attention to. It's like all your senses awaken because of the increased responsibility that you have sensed in the background of the entire thing and your newness to the whole thing. Does it produce a little bit of anxiety? Yeah, but getting you out of your comfort state and on the edge of your fear state, that's the only way to turn your senses on and kick them up. So you're paying attention to all aspects of things at a superhuman level. Now that as the psychomotor skills develop and you start repeating the experiences, that heightened state of awareness does go away, but it's already done its job as far as you learning at a really accelerated pace. It's very powerful. Okay. So we want to transfer learning. We want you to say, okay, these are the concepts. This is the practical application of those concepts. Therefore, this is how I should proceed. And let me give that a whirl. Here we go. Okay. And then you jump on the bike and you ride it. Right. You didn't know that your dad let go 5 seconds ago and you've been going for 20 feet now. You didn't know, but it is going to feel exactly like that. You're going to turn around one time and, to ask a question to the tech, and they're not going to be there. They're going to be behind the control panel waiting for you. You'll be like, oh my God, the training wheels are off. Yeah, it's going to be fantastic. Frightening, but also fantastic at the same time. You're going to get good feedback from people who have been where you are. Okay. These folks, they do have the psychomotor skills. They can do the exams automatically. They can see where you're stumbling. Okay. Now, some of them don't have the patience that others do. Patience is a prerequisite for teaching. But you are going to have some that really have the teaching bug and have the patience and be like, okay, this is what I see you doing. This is what you ought to be doing. Okay. And so, hang on just a second. Wrong number. Okay. Sorry about that. So you are going to get those corrective moments. Now, hopefully those aren't in front of the patients. Again, some people have the teaching bug, some people don't. Okay. But regardless of where you get those corrective moments, try not to, don't let your emotions get control of you in that moment. Just try to let go of your emotions and listen to what that technologist is saying. Okay. And really take that in. I know it's criticism. I know you're wanting to do your best, but okay, it's part of the learning process. Is someone else is evaluating you and assessing you and telling you what you're doing wrong. You have to be comfortable with that. You got to be mature about that. You got to understand that the big picture is they want you to fix that so that you can be a good technologist. They're not trying to pick on you. They are regardless of, again, some techs know how to phrase it. Some techs are a little coarse with their criticism. Okay? Try not to worry too much about that. Worry more about, okay, how do I fix this? How do I become a better technologist in this particular aspect? What is it the tech wants me to do differently? Okay. All right. In the learning process, there are performance objectives. And so when I roll out the clinical syllabus to you guys, I'm also going to show you the evaluation forms, both the competency form and the performance evaluation form. Okay. The ART has established minimum number of clinical competencies in various exam categories. That PDF of what their competency requirements are is on the Documents tab of Trajexis. Competence must be performed independently, consistently, and effectively. So you can, at any time, you can be recomped that is evaluated for competency, even if you already have competency. Okay. Student supervision can be direct and indirect. If you have not been judged competent on the particular exam, it should be direct supervision. And the technologists know this, and the students know this. And so, you are not allowed to start any exam that you have not achieved competency on without a technologist present. Okay? If a technologist is not present, then you cannot start the exam. If a technologist disappears, well then that's awkward to explain to the patient, but you have to pause the exam until the technologist reappears. Okay? Eligibility for the credentialing exam, that is to get your credential and to be qualified to be hired as a technologist, requires that all of their competencies that they outline on that PDF are met and documented by program officials. That would be me. Okay? So I'm going to audit your competencies before graduation. Okay? Organizational chart for radiography program. At the very top is Mr. Shepard, the program director. Didactic faculty, we're actually in the process of looking for an adjunct professor at this moment in time. Clinical coordinator, that's me. Clinical faculty and clinical staff. The clinical faculty refers to the clinical preceptors. Now, I'm not directly supervisory over the clinical staff, but I do expect the clinical preceptor to instruct the clinical staff on critical information, especially standards of supervision. Okay? And all the way at the bottom of the totem pole are the students. Okay? And so there's a chain of command. Both the faculty, the staff, and the coordinator and the director are in charge of you in the clinical setting as if we were your employer. So your phases of learning, at first, I do expect you to watch aggressively, okay? But you should be transitioning, I would say, by Thanksgiving. At the latest, you should be starting to attempt some stuff. You know, if you're very, very shy and very, very intimidated and have anxiety, the first 2 weeks, yeah, we're going to cut you some slack, okay? But you should be starting to acclimate and be comfortable in the clinical setting by week 3 or so, which would be right before Thanksgiving, okay? So now we do have some students that are so comfortable that they start doing competencies by the end of week 1. We've had that. That's a regular occurrence that I get at least, I would say, a third to a half the class is qualified to comp on the chest x-ray by Friday afternoon of week 1. And they get the comp for the 2-view chest x-ray. That's not unusual, okay? It's also not unusual for someone to be a little bit more reserved and a little bit more scared, but you have to work on it. You have to acknowledge that you're in that mindset, and you have to work on getting comfortable, okay? You just can't be a wallflower in clinical learning. You have to start, we need you to transition to performance, because that's when real learning takes place, okay? You will pick up some things watching, you'll pick up more things helping out, but you'll pick up the most understanding actually trying to do it yourself, okay? And some of the techs are going to push you before you think you're ready, okay? Just take a deep breath and lean into that, all right? It's going to be fine. They're not going to let you hurt the patient. I promise you, they are not going to let you hurt the patient. Okay. So clinical education policies in the clinical manual, which is the last half of the student handbook, we've got standards of supervision, performance of exams, simulations, assessments. Those would be your performance evaluation, protection practices, disciplinary procedures, ethics, standards, HIPAA and privacy standards, professional appearance and behavior, attendance and tardiness, and a pregnancy policy. Some of those policies are in the radiation protection policies, but those apply to, radiation protection applies to laboratory as well as it does clinical education. That's why we have them separate from clinical education. Okay. Clinical development. Okay, didactic lab clinical. You're going to learn about how to do a chest x-ray. What are the two views involved? How do you set those up? Okay, you're going to practice those on your fellow classmates, and then you're going to actually try to perform those on real life patients. Okay, that's a natural process of transitioning from book learning and talking about concepts to practical application and actual performance of complex, skilled tasks. Okay. This method for clinical education is what's recommended and required by the JRC ERT. Okay. All right, so we talked about clinical education. We talked about what is its design, what is its goals, what's its intentions, how are you going to progress in clinical education, what domains of learning are you going to utilize, what's your descent into levels of experience going to be like. And remember, it's a staircase. You take it step by step, and at the end of the 2 years, you're a competent technologist, and you're well educated, and you're well versed in a wide variety of procedures because your clinical education was so robust. Okay. All right, so the whole point is to have you ready to be a performer of the job straight after graduation. First day after graduation, you are not only registry eligible, but you're employable too, because you know how to do the procedures. You have plenty of experience in those procedures. You have regular attendance habits. You have good communication skills, and you have professionalism skills. Okay? And you think like an X-ray tech, you act like an X-ray tech, you dress like an X-ray tech, and you perform like an X-ray tech. Okay? You need to glean information from clinical staff and especially your preceptor. You need to be seeking meaningful feedback and then working on that meaningful feedback in order to get better the next week. You're not competing with your fellow classmates. You're not competing with the techs. You're competing with who were you yesterday? And what did you know how to do? And how skilled were you yesterday? That's who you're really competing with. All right. See you guys in class.